Hello, and welcome to the training on supporting access and accommodations for victim survivors. I'm Amy, the Disabilities Grant Coordinator at the Sexual Violence Center. And I'm going to start by telling you about the program that created the policy and procedure to support access and accommodation. The policy and procedure were created by Accessing Safety in Hennepin County, which is a collaboration between the ARC of Minnesota and the Sexual Violence Center. This work was funded by a grant through the Office on Violence Against Women from 2013 until 2020. The mission of the collaboration is to improve how both agencies support victim survivors with intellectual and developmental disabilities. The two agencies will work together to provide services that respect and empower victim survivors. Accessing Safety in Hennepin County will help victim survivors get the skills and resources they need to heal. After today's training, you will understand the definition of access, be ready to offer accommodations to victim survivors, and recognize the way that accommodations are already being made through standard practices here at SVC. As we have talked about in other trainings, your role as an advocate does not change when working with someone who may need accommodations. Our role is to be victim survivor centered. We do this by providing support and validation, offering options and letting the victim survivor decide what to do next, and advocating for the person and what that person wants whenever possible. It is not your role to decide if a person needs a specific accommodation. You might support victim survivors with the same disability who each need different accommodations. Never assume that someone needs a certain type of accommodation because they have a certain type of disability. So what is access? SVC defines access as organizational practices and physical environments that support victim survivors to participate in all aspects of SVC services. Making efforts to offer accommodations will help ensure that victim survivors can access services fully. So, some general considerations. We are already providing and offering accommodations to victim survivors in a variety of ways through general practices here at SVC. Some examples are letting victim survivors choose the room that they receive counseling in, offering to adjust the lighting, meeting victim survivors outside of the office at locations that work best for them. These general practices can all be considered informal accommodations. Our practice of letting victim survivors guide our conversations with them can also be looked at as an accommodation. When we give victim survivors time to think, to take their time with questions, and when we allow moments of silence, these all support people who have experienced trauma, along with supporting people who have some types of intellectual and developmental disabilities. Some people you work with may communicate in ways other than spoken English. They might use a communication board or device. They might have an interpreter, use American Sign Language, or use their own unique hand gestures to communicate. If you're having a hard time understanding a victim survivor, it is always okay to ask for clarification in a respectful way. For example, you could say, "Let me repeat what I heard you say. Did I miss anything?" Or, "I'm not sure I understood what you were saying. Can you say that again?" When scheduling an appointment at SVC, you should inform victim survivors of our access options. You can say something like, "There are accessible parking spaces in front of our building and an automatic door opener as you enter. Our office is on the 4th floor. The elevators and stairs are to your right as you come in the building. Interpreters can be provided at no cost. We have rooms that can accommodate a wheelchair or other mobility device." You can even ask if someone needs room reserved for mobility devices, or if they would like to discuss any other accommodations. This script is provided in the procedure. We've already talked about some of the ways that we provide informal accommodations. letting people choose where they sit, letting them choose lighting, etc. Informal accommodations can also be reading through documents together with a victim survivor, providing them with copies to take with them, offering documents in larger font or other formats if available. When providing in-person services at SVC, it's important to let victim survivors know where the bathrooms are. You can say something like, we have gendered bathrooms on this floor, an accessible gendered bathroom on the 3rd floor, and private accessible bathrooms on the lower level. That is the LL button in the elevator. When providing services outside of SVC, it is your responsibility to find accessible location. Always ask the victim survivor what location would work best for them. Accessibility at community locations could be buildings with accessible doors, with automatic door openers, and rooms that are considered accessible for someone using a wheelchair. It might even be looking at the accessibility of the location itself, such as it being on a bus line, a location that has a parking lot, or other features that might make it accessible for a victim survivor. While you're speaking with victim survivors, make sure the pace of your words works for them. If you're unsure, ask them. Explain terms and encourage them to ask if they do not understand. Check in with the victim survivor and ask them if the information you provide is helpful. Offer to use pictures to help the conversation. Offer to write down information that the victim survivor might need for follow-up. Examples of this might be the date and time of the next one-to-one that you schedule. Could be our crisis line number, or it might be their case number if they are making a police report. More formal conversations about accommodations can start when we collect demographics. It is not appropriate to ask someone if they have a disability, but we need to ask this question when we gather demographics. The only time we would ask someone if they have a disability is while collecting demographics. You can ask by saying, do you have a disability you would like to share with me? Even if a victim survivor doesn't identify as having a disability, they might benefit from accommodations while receiving services. We should offer to discuss accommodations with all victim survivors. Scripts to do this are provided in the procedure. Always offer accommodations. Never assume or insist that someone will need one. Sometimes things come up that we have no control over, such as equipment failure or medical emergencies. We cannot prepare for every situation, but we can attempt to have discussions around the best way to support a victim survivor in case they have an emergency. We can use care plans to outline how staff or volunteers can provide support during an emergency. An example of an emergency could be it could be if you're working with a victim survivor who has frequent seizures. That person might be concerned about having a seizure while meeting an advocate at SVC. You can have a conversation with that person about what should be done in case they have a seizure. They might want an advocate to call 911 or to call a friend or family member. Those details can be written in a care plan. While you will not often need to have conversations about emergencies like this, it is important that you know how to. Once you and the victim survivor have made a plan, make sure to talk to SVC staff so that they can create that care plan. Access here at SVC is organizational practices and physical environments that support victim survivors to participate in all aspects of SVC services. Read through the policy and procedure. There are scripts in the procedure to give you examples of how to talk about accommodations. Can you think of ways that you've provided an informal accommodation to a victim survivor? Or if you haven't provided direct services yet, what are some ways that you might provide informal accommodations? We've talked about some already, so feel free to use examples given. Thank you for watching this training.